Hi, good afternoon. So I would like to discuss with you today about the misconception regarding the dynamics of body weight and their relationship, its relationship with the actual NPI, the non-pharmacological interventions. So we will follow these several items. First of all, after an introduction to define what we are going to talk about, we'll go through some basic concepts about obesity and body weight and how they relate to complex dynamic systems and models. On this base, I will propose you to have some kind of experience altogether to check out what this stock and flow failure is about. And on this base, we will extract some key findings and implications in order to get to a conclusion that will open to, I hope, some kind of discussion. So first of all, as an introduction, I would like to say that the NPI, non-pharmacological interventions, have to been applied and performed with the patients in order, of course, to improve the health of the patient. For this desired outcome to be reached, we need to have some level of compliance and commitment from the patient. Compliance meaning to apply the proper procedure of the NPI, and commitment meaning to apply the NPI on a period of time sufficiently large enough in order to get the desired results. For this, the patient has to change his former behavior in order to get the expected results. And for this also, it is based on a decision. And this decision finds usually its roots in a minimal level of understanding about his body functions and how the NPI therapy will act on the body functions. And this knowledge has to be shared, of course, with the healthcare providers, the healthcare professionals. The point we focused on with our lab was about how the expected outcome, if the sequence is respected, will have a positive feedback on the patients and on the use of NPI, but also if there is something wrong in the sequence, what's gonna happen in terms of negative feedback. And we focused on the study of one of the basic, we think, elements in this sequence, in its understanding. So in the case of obesity, we should remind that obesity, as you may know, is a global public health issue. It's a pandemic worldwide, even in Western countries and in emerging countries, and it's a non-communicable disease. So it is related to a change in the pattern of the behavior of the patients. This is associated also with comorbidities, as you may know, so that's why it's a very deep burden for many countries in the world. But the most important thing about obesity is that, as you can see on this little graph here, it is a very and highly complex disease, much more complex than most people think. And since it is considered as a complex disease, then we can apply on this disease the complex system theory, which means a systemic understanding and systemic reflection. And the higher the complexity of the system is usually correlated with a high level of misconception, mainly in patients. So when we talk about obesity, as you can see, there is a lot of variables that are deeply interconnected with feedbacks, delays, stock, positive and negative influence. And this is really difficult to get and to understand for the patient. So when the patient is trying to deal with weight management and obesity, actually the subject is trying to make decision about the most sophisticated and complex dynamic system that exists, which is the human body. And in order to be able to manage this system, he has to have a minimum level of understanding of this. Now, how human beings do when they have to face a complex system? Well, when you look at a complex dynamic system, which is the real system, the human body, for example, and this is true for any kind of complex system in the nature or in society, then all human beings, you, me, we are all trying to develop in our head a virtual system. This virtual system is actually a simplified mental model of the real system. In order to get these things working, we need two skills. Human beings need two skills. The first skill is to develop the adequate model of the real system, and this is based on understanding the structure of the system. Once this is done, then the simplified model is performed inside the head of the individual, and then the second skill is the ability to actually run the model in your head in order to try to infer system behavior over time, meaning try to predict how the system will react if we change something in our behavior. So this is about decision making. And then the decision being made, we act on the system, and later on we will try to optimize the simplified mental model. And that's the issue here. When you face highly complex system, there is a high level of risk of misconceptions at both the skill on the skill 1 and also on the skill 2, sometimes both, sometimes one or the other. In the case of obesity, there is a warning, is that the skill 1, usually the people have this skill and the ability to have an adequate mental model. The problem is about running the model. So when you have an understanding of the system structure, it actually does not guarantee you that it will be possible to predict the system behavior over time, and therefore to have a proper decision making to run the system. So that's where we come to the concept of the stock and flow failure. So here, instead of talking, it would take a lot of time. I propose you that we do a little exercise with Mr. Bean here. And this exercise is a sketching exercise. We can take a minute or so. This is an exercise that we propose worldwide on 600 subjects, both lay people without any healthcare background and to healthcare professionals. And this has been performed in 7 countries. So here is the exercise. It's a little exercise. On the top part of this of the sheet, you can see here 2 types of lines. The first one, the dashed line, is the daily energy expenditure. Okay, so it is stable for all the assay at 2,000 kilocalories per day. And then you have the second line, here's a plain line, which is the daily caloric intake, meaning what we are eating. It is also stable at 2,000 kilocalories per day, except at 2 time points. The first time point is Thanksgiving, and the second time point is Christmas. So we all know that at this period we have a family gathering, and we eat more food and more caloric food. So the caloric intake goes up about from 2,000 to 2,500. Okay. Now on this base we ask our subject, can you try to sketch on the lower part of the sheet here, how do you think that your weight would evolve during the same period of time? So I suggest that you take a piece of paper, or if you just think about it, I give you 30 seconds, and try to see how you would see your weight evolve during this period of time. And just after this, we will look at the correct solution and how can we extract data from this. Are you okay with this? Just take 30 seconds. When you think about this question, you don't have to worry about the actual numbers, the amount of increase or decrease. It doesn't really matter. The most important thing is when you think about it or when you sketch it, is actually the shape of the curve that you're going to try to anticipate. Okay? So let's say that you think about it, and then we go for the proper solution. So the actual proper solution, the correct solution that subject was supposed to give was the following one here. So to explain this evolution of this body weight, it means that here, when you have a daily caloric intake and daily caloric expenditure that are equal, it means that there is no body weight gain. So the weight is quite stable each time those 2 parameters are equal. Now, if you have this increase here about caloric intake when energy expenditure stays the same, then obviously there is a stock accumulation of energy, and therefore the body weight goes up. So this is the actual correct solution. Now, let's take a look at what the subject of our study have answered. There was 4 typical responses that were recorded. First, some people gave the correct answer here that we just saw. And then we have three main type of answers, and these 3 main type of answers share a common feature. This common feature is that people tend to correlate the increase of body weight with the increase of energy intake. And some of them, here and here, tends to correlate also the decrease in caloric intake and the decrease in weight gain. Right. This is the first observation. The second observation, which is really interesting and somehow a bit disturbing, is the percentage of answers. What we noticed is that 76% of lay subjects, people with no medical background, failed to give the correct answer. And 71% of healthcare professionals failed to give the proper answer. And there is no statistical difference between the 2 groups. So this was very surprising. So we tried to understand the reason why this phenomenon appeared. And to understand this, we asked the participant to tell us how did they create their mental model about obesity. And surprisingly, most of them have had the adequate model. The adequate model is what we call the body weight stock and flow model, where body weight varies as a function of the difference between energy intake and energy expenditure. I'm sure that if we ask anyone in this room, you will have the same concept already in your mind. So it means that most of the subjects had the proper adequate model, mental model in their mind. Even if this is a high simplification of the obesity, but it does work in terms of reasoning. There is in the literature you can find a plumbing analogy about this body and flow, stock and flow model. If you consider that body weight is a bathtub, the energy intake is water flowing in, and the expenditure is the water flowing out. So what happened is that the subject that responded to the test had the proper mental model, but they failed in running the model. So it's a skill too that doesn't match with what's going on. So the stock and flow failure is actually a misunderstanding and a misconception about not the structure of the system, but the dynamic behavior of the system. And if this stock and flow failure happen, then obviously the subject will provide erroneous prediction of the system behavior over time, and therefore there will be a wrong decision making, and this will contribute to an increase in the level of obesity. So on this base, what are the key findings of this assay? The key finding is that we noticed that there is no exception in stock and flow dynamics failure because it touches as much the lay subject and healthcare professionals. So it means that they share a pervasive deficiency in human reasoning. And this deficiency is known as a cognitive error, which is the correlation heuristic. Correlation heuristic means that people tend to match the behavior of calorie intake with the body weight, the dynamic of the body weight. So based on this cognitive error, then you have this erroneous inference, erroneous prediction that jeopardize decision-making about the body weight management, and therefore it compromises any management of the obesity status of the individuals. And this is associated with the high complexity of obesity and the fact that when we take a decision that is erroneous, we'll get very wrong results. So on this base, how can we relate these elements to non-pharmacological intervention? And this will be my conclusion. We have identified a problem. This problem is stock and flow misconception in the dynamic feature of the phenomenon, leading to erroneous inference, so erroneous prediction. So human beings, therefore, demonstrate that even if they have the proper structure of the model, of the system, they cannot manage what they don't fully or partially understand. So the risk here is that it severely undermines, this observation severely undermines the obesity prevention and management at both the level of population and individual. And it also compromises the potential positive effects that health government policy tend to correct. So what is the need? Well, the need is some kind of a paradigm shift, not a big shift, just a little bit shift. Because we have to develop some kind of an intuitive and appropriate, not correlation heuristic, but systemic heuristic, meaning learn to people how to resonate at the system level and not just on a linearly about their health issue. So one of the solutions would be to provide a non-pharmacological intervention, which would be to provide a system-based insight about the health condition of the patient. So it means that open the people's mind about the fact that, yes, they can use correlation heuristic for some issues, but for complex issues, they should shift the way they think to systemic correlations. So, and this has to be performed on healthcare providers and patients, because we've seen that they share the same difficulty. So this is the actual message that we are working right now on the way to open people to this type of reasoning. And it's, we think it's quite important, since this is applicable to obesity. It's also applicable to a lot of type of chronic diseases, and it's also the same problems that arise about economic, about environment, about finances, and all these kind of things that we all experience in our society, because our society are becoming much, much more complex than what we are used to resonate. Okay. So this is the end of my talk, and I thank you very much, the organizing committee, for inviting me here today, and I hope that you have questions so we can discuss about this issue.